How do image-guided biopsies diagnose rare bone tumors? Imagine trying to find a tiny needle in a haystack. That's similar to how doctors locate and diagnose rare bone tumors. They use a technique called image-guided biopsy, which combines advanced imaging with a small tissue sample. This method is essential because rare bone tumors can be small, hidden deep inside the bone, or look unusual on scans. To start, doctors use imaging tools like computed tomography scans, magnetic resonance imaging, or ultrasound. These images help pinpoint exactly where the suspicious area is within the bone, guiding the doctor to the right spot. Once the location is clear, a radiologist or an interventional specialist carefully inserts a thin needle through the skin and into the bone lesion, guided precisely by the imaging. The needle then collects a tiny piece of tissue from the tumor. This sample is sent to a pathology lab, where specialized doctors examine it under a microscope. They look for specific cellular features to determine if the tumor is benign or malignant and identify the exact type of cancer, such as chondrosarcoma, Ewing sarcoma, or osteosarcoma. This approach is highly accurate, with studies showing diagnostic success rates often above 85%. For rare tumors, this accuracy is especially important because these tumors can have atypical features that make them harder to identify. Using imaging guidance ensures the tissue sample is taken from the most suspicious part of the lesion, reducing sampling errors. It also minimizes the invasiveness of the procedure, making it safer and more comfortable for patients. However, there are some limitations. Sometimes the sample may not be enough or may not representing the entire tumor, especially if the tumor is very heterogeneous. In rare cases, the initial biopsy might not give a definitive answer, and doctors may need to do additional imaging or even repeat the biopsy. In most cases, after initial imaging shows a suspicious lesion, an image-guided biopsy is the next step. It helps doctors make an accurate diagnosis, which is vital for planning the best treatment options. Whether surgery, chemotherapy, or radiation therapy is needed, knowing exactly what type of tumor is present guides the decision-making process. In summary, image-guided biopsies are a crucial tool in diagnosing rare bone tumors. They allow for precise, targeted tissue collection, enabling pathologists to identify the tumor accurately. This process supports timely, effective treatment planning and ultimately helps improve patient outcomes. Always remember, if you or someone you know has a suspicious bone lesion, consulting a healthcare professional is essential for personalized care.